I want to tell you about a patient I'll never forget. He was 67 years old, retired engineer, careful man, the kind of person who took his medication every morning without fail, went to his annual checkups, watched his diet during the day. His wife called me on a Tuesday morning. He hadn't woken up. When I reviewed his case, his habits, his history, the hours before he went to sleep that night, nothing looked alarming on paper. No dramatic warning signs. No acute emergency the evening before. But when I looked closely at what he did every single night, the pattern was there. It had always been there. Quiet, invisible, completely ordinary. And that is the word I keep coming back to when I think about what I'm going to share with you today. Ordinary. The habits that damage the heart after 60 don't look dangerous. They look like dinner. They look like a preference for a warm bedroom. They look like the reasonable decision not to drink too much water before bed so you don't have to get up at 3 in the morning. They look like Tuesday night. I've spent over 2 decades in medicine. I've worked inside hospitals, inside operating rooms, inside systems that are very good at responding to cardiac emergencies and not nearly good enough at preventing them. And what I've seen, case after case, year after year, is that the most dangerous cardiac events in people over 60 are not the dramatic ones. They are the quiet ones, the ones that build slowly, night after night, in the hours when no one is watching, in the hours when your body's defenses are reduced and your habits are left to run unchecked. Today, I'm going to walk you through the specific nighttime habits that carry the highest cardiac risk for people over 60. Not because I want you to be frightened, because I want you to be informed. And because what I've learned after everything I've seen is this. Most of the cardiac damage I've witnessed was preventable. Not with surgery, not with expensive interventions, with information, with small adjustments to ordinary evenings. You deserve to have that information before it becomes relevant in a waiting room. Stay with me. Because what I'm going to explain, especially the third habit, is the one that consistently surprises people the most, including people who consider themselves careful about their health, including some of my colleagues who should have known better. Let's start at the foundation. Before we get into specific habits, I need you to understand something about what actually happens inside your body during the night after the age of 60. Because once this is clear, everything else I share today will make complete sense. Your cardiovascular system never fully stops working. Even during sleep, your heart is contracting, your blood is circulating, your arteries are under constant pressure. But nighttime is supposed to be different. In a healthy cardiovascular system, sleep triggers what medicine calls the nocturnal dip. Blood pressure drops naturally, typically 10 to 20% lower than daytime levels. Heart rate slows. The arteries, freed from the demand of full daytime circulation, get a chance to recover. It's not just rest, it's biological maintenance, a nightly reset that the cardiovascular system has been running since you were born. After 60, that system becomes less reliable. The blood vessels have stiffened with decades of use. The hormonal signals that used to regulate nighttime blood pressure precisely have weakened. The mechanisms that compensated for small problems during the day are less available during the night. Think of it as a building that runs on a full engineering crew during the day. At night, the crew goes home. A skeleton team takes over. The building still functions. But if something goes wrong, a pipe under pressure, a circuit overloaded, there are fewer people to catch it before it becomes a disaster. That is your cardiovascular system after 60, between midnight and 6 in the morning. And here is the critical piece that most people never connect. What happens during those vulnerable hours is largely determined by what you did before you turned off the light. The meal you ate, the medication you took or didn't take, the temperature you set, the water you didn't drink. Decisions that felt completely routine. Decisions that, stacked together over months and years, are either protecting that skeleton crew or overwhelming it. That is what we are going to talk about, starting with the habit that I encounter most often, and the one with the most direct cardiac consequences. The first habit, eating a heavy meal late in the evening. I want to ask you something, and I want you to answer it honestly, even if just to yourself. What time did you eat dinner last night? And what was on the plate? I ask every patient that question. And for a significant number of people over 60, the answer is somewhere between 8 and 10 at night. A full meal. Pasta, rice, Protein, something fried. Eaten on the couch in front of the television, followed by bed within an hour or two. I understand exactly why this happens. The day runs long, family schedules shift, the habit of a lifetime is hard to examine, and the meal itself feels completely harmless. You've been eating dinner your whole life, but here is what is actually happening inside your body during those evening hours, and why the timing matters in ways most people are never told. When you eat a substantial meal, your digestive system immediately demands a significant increase in blood flow. Blood is redirected toward the gut. Your heart has to pump harder to accommodate that demand. Blood pressure rises in response. And within 2 to 4 hours of eating, particularly after a meal heavy in fat and refined carbohydrates, triglycerides, the fats circulating in your blood, spike sharply. Under normal circumstances, the body handles this well. The digestive surge passes, the triglycerides clear, blood pressure normalizes. But now layer that process on top of going to sleep. Your body's expectation for the evening is a wind down, the gradual shift toward lower demand, lower pressure, slower circulation. That is what the cardiovascular system is preparing for. Instead, it receives a full digestive emergency at the exact moment it's trying to reduce its workload. Those two processes, one demanding maximum cardiac output, the other requiring minimal cardiac activity, are in direct conflict. In a person over 60 with any degree of arterial stiffness, with blood vessels that don't accommodate pressure swings as flexibly as they once did, that conflict is not harmless. Research consistently shows that eating within 2 to 3 hours of sleep is associated with elevated nighttime blood pressure, disrupted sleep architecture that reduces the quality of the cardiovascular reset, and increased risk of adverse cardiac events during the early morning hours. This is not a complicated problem to address. The solution is genuinely simple. Finish your main meal by 6 or 7 in the evening. If you genuinely cannot eat earlier, keep the late meal light. Lean protein, vegetables, a small portion, not a full dinner. A meal that asks very little of your cardiovascular system before it needs to slow down. The 3 to 4 hours between your last meal and sleep is not an arbitrary recommendation. It is the biological window your heart needs to complete the digestive demand before beginning its overnight work. Think about your dinner schedule tonight. Does it give your heart that window? And if you're finding this conversation useful, if this is the kind of direct, unfiltered information you believe people over 60 deserve to have, I want to ask you something now. Subscribe to this channel. Turn on notifications. Every video here exists for exactly this reason, to give you what the rushed medical appointment doesn't make time for. That's the entire purpose of this channel. Hit subscribe and let's keep going. The second habit, the blood pressure medication timing problem. This is the one I need you to take most seriously, because in my experience, it is where the most preventable cardiac damage occurs. And it involves a conversation that the majority of patients over 60 have simply never had with their doctor. If you take medication for high blood pressure, and statistically more than half of people over 60 do, the timing of that medication is not a minor detail. It is one of the most clinically significant decisions in your cardiac care. Here is what most patients understand about blood pressure medication. Take it every day, usually in the morning. Here is what most patients don't understand. Whether morning dosing actually covers the hours when their heart is most vulnerable. Blood pressure in a healthy body follows a predictable daily rhythm. It rises in the morning when you wake up, peaks in the afternoon, and then drops during the evening and night, that nocturnal dip I described earlier. But a significant percentage of people over 60, particularly those with established hypertension, don't follow that pattern. Their blood pressure doesn't dip at night the way it should. In some cases, it actually rises during the early morning hours, between 2 and 6 a.m., when the body's natural regulatory mechanisms are at their weakest. This pattern has a clinical name, nocturnal hypertension, and it is associated with substantially higher rates of heart attack, stroke, and cardiovascular mortality than standard daytime hypertension. Not slightly higher, substantially higher. Here is why. During the day, the arterial walls are, in a sense, primed. The cardiovascular system is active, responsive, adaptable. A pressure spike during the afternoon is unwelcome, but the system has mechanisms to handle it. During the night, those mechanisms are reduced. The arterial walls are in their most vulnerable state. A pressure surge at 3 in the morning hits differently than one at 3 in the afternoon. It is more likely to stress vulnerable plaque, more likely to trigger a clot, more likely to cause the kind of event that nobody sees coming because it happens in the dark, in silence, while the rest of the house is asleep. If your blood pressure medication was prescribed to be taken in the morning, and it reaches its maximum effect around midday and begins wearing off by evening, you may have almost no protection during the hours when your arteries are most at risk. There is substantial clinical evidence, and including research from large-scale cardiovascular trials, that evening dosing of blood pressure medication provides meaningfully greater protection during the nighttime hours for many patients. Not for all patients. For some medications, timing matters less. For others, it matters enormously. The critical point is this: the conversation about when your medication is most effective for your specific profile is a conversation worth having. Explicitly. With your doctor. Soon. Ask the question directly. Given my blood pressure pattern and the medications I'm on, should any of my doses be timed for the evening rather than the morning? That question takes 2 minutes. The answer could be the most important thing you discuss at your next appointment. Do not assume the timing has been optimized. In my experience, it rarely has. Not because doctors are careless, but because the appointment doesn't always go that far. You need to take it there yourself. The third habit, and I told you at the start this would be the one that surprises people most: untreated sleep apnea. I want to reframe how you think about snoring before I explain this. Because most people, including most people who snore, treat it as an inconvenience, a noise issue, something the person in the next room finds annoying. After 2 decades in this field, I treat heavy snoring as a cardiac warning signal until I have evidence otherwise. I mean that completely literally. Sleep apnea is a condition where the airway repeatedly collapses during sleep, partially or completely, stopping normal breathing for seconds at a time, sometimes longer. It is estimated that over 30% of adults over 60 have some form of it, and the vast majority have never been diagnosed. They have no idea what is happening in their body every single night. Let me describe what actually occurs during an apnea episode, because the clinical reality is far more serious than most people realize. You stop breathing. Your oxygen level drops. Within seconds, your brain registers a physiological crisis and fires a stress response: adrenaline, cortisol, an abrupt spike in both heart rate and blood pressure. Your heart jolts into emergency response while the rest of you remains asleep. Now imagine that happening 30 times in a single night, 40 times. In some patients, over 50 times per hour. Each episode is a small cardiac emergency. Each spike in blood pressure and heart rate is a small assault on the arterial walls. Each adrenaline surge is an unnecessary activation of your stress response system, a system that, used this frequently, begins to leave permanent marks on the cardiovascular structure. Sleep apnea is directly associated with a significantly elevated risk of heart attack. It is strongly linked to atrial fibrillation, the irregular heart rhythm that is itself one of the leading causes of stroke in people over 60. It accelerates the thickening and stiffening of arterial walls, and because all of this happens during sleep, the person experiencing it often has no awareness whatsoever until something serious occurs. The warning signs are not always obvious snoring. Watch for waking with headaches that weren't there when you went to sleep, feeling genuinely exhausted after what should have been a full night's rest, needing to urinate multiple times during the night. This can actually be a response to the repeated microarousals caused by apnea episodes. Waking with a dry mouth, or a feeling of having choked or gasped. If any of those are familiar, this deserves prompt attention. Not next month, not at your next annual checkup, if that's 6 months away. Soon. A sleep study, which can now often be done at home with equipment your doctor provides, will tell you within a single night whether apnea is occurring and how frequently. If it is, the most common treatment is a CPAP device. I know the reputation. I know patients resist it, but I want to tell you directly. The cardiovascular data on CPAP compliance is some of the most compelling I have seen in preventive cardiology. Measurable reductions in blood pressure, lower rates of atrial fibrillation, significantly reduced cardiac risk. One device, one change to your nighttime routine. The cardiac protection is real, and it is documented. If you share a bed with someone, ask them tonight whether you snore. Ask whether they've ever noticed you stopping breathing. The person sleeping next to you may have information about your cardiac risk that you've never thought to ask for. The fourth habit, deliberate dehydration before bed. This one is driven by entirely rational thinking, and that is exactly what makes it so easy to overlook as a cardiac risk. Many people over 60 consciously limit their fluid intake in the evening. The reasoning is straightforward. They want to avoid being woken up at 2 or 3 in the morning to use the bathroom. Disrupted sleep is exhausting. Getting up at night increases fall risk. Avoiding that means drinking less in the hours before bed. Completely logical. But here is what is happening in the cardiovascular system when you go to sleep even mildly dehydrated. Your blood becomes more viscous, thicker. It doesn't flow as freely through the vessels. For a young cardiovascular system with flexible, responsive arteries, that temporary thickening is a manageable inconvenience. For a person over 60 with some degree of arterial stiffness, with blood vessels that have less elastic capacity to accommodate changes in flow, thicker blood moving through narrowed passages is a genuinely different situation. Now add the physiology of sleep itself. During sleep, your heart rate naturally slows. Blood moves through the system more slowly than it does during the day. You are lying still, so the natural pumping assistance of muscle movement is gone. Your body temperature may fluctuate, affecting vessel diameter. And those arterial walls that were already dealing with some degree of stiffness are now being asked to handle blood that is more prone to clot formation, moving more slowly through passages that may already be partially narrowed. This is one of the established reasons why strokes and cardiac events cluster in the early morning hours. The combination of reduced cardiac output during sleep, reduced physical movement, and blood that has thickened through the night. The practical response to this is extremely simple. A glass of water, 8 ounces, nothing dramatic, before bed. Enough to ensure your blood viscosity doesn't increase unnecessarily while you sleep. Keep another glass on the nightstand, so that if you wake during the night with any sense of thirst, you can address it immediately. You are not trying to be fully hydrated at 3 in the morning. You are simply avoiding the unnecessary thickening that happens when the body goes 8 hours without any fluid intake, while simultaneously running its most reduced cardiovascular mode. 1 glass. Before bed. It is not a difficult change. It is a meaningful one. The fifth habit. Sleeping in a room that is the wrong temperature. I want you to think for a moment about what your bedroom feels like tonight when you go to sleep. Not in terms of comfort, in terms of what it asks of your cardiovascular system. Most people have never thought about bedroom temperature in cardiac terms. They think about personal preference, whether they run hot or cold, whether a partner prefers different conditions. But there is a specific temperature window within which your cardiovascular system functions best during sleep. Outside that window, on either side, your heart is working harder than it needs to. Let's start with too warm. When a bedroom is above approximately 22 degrees Celsius, roughly 72 degrees Fahrenheit, your body works continuously through the night to dissipate heat. Blood vessels dilate in an attempt to release heat through the skin. Heart rate remains elevated. Sweating increases, which means fluid loss, which brings us directly back to the dehydration risk we just discussed. And sleep quality drops measurably. You spend less time in the deeper restorative stages where the heart gets its most effective overnight recovery. Less deep sleep means a less complete cardiovascular reset. Night after night, that incomplete reset accumulates. Now the other direction. A bedroom that is genuinely cold, below 16 or 17 degrees Celsius, around 60 degrees Fahrenheit, creates a different cardiovascular pressure. Cold triggers vasoconstriction. The blood vessels narrow to preserve core body temperature. Blood pressure rises in response to the increased resistance. For someone with existing coronary artery disease, or with hypertension that isn't perfectly controlled, that nighttime pressure increase matters. It adds to the load on an already stressed system during the hours when that system has the least capacity to compensate. The optimal range, based on both sleep physiology and cardiovascular research, is between 18 and 22 degrees Celsius, approximately 65 to 72 degrees Fahrenheit. That window keeps the body in what physiologists call thermoneutral territory. Vessels are relaxed. Heart rate stays low and steady. Sleep architecture stays deep. The cardiovascular reset that your heart depends on every single night runs the way it's supposed to. One thermostat setting, real cardiac protection, no other change required. Now I want to bring everything together. Because I'm aware that 5 habits, all discussed in detail, can start to feel like a list of things to worry about. And worry is not what I'm here to leave you with. What I want to leave you with is a framework, a simple, practical evening routine that addresses every single one of these habits simultaneously. Something you can start tonight, not someday. I think of it as the heart-safe evening. Here is what it looks like in practice. Between 6 and 7 in the evening, your main meal. Lean protein, vegetables, a moderate amount of whatever carbohydrate you need. Not a feast, not a deprivation. A proper dinner eaten at an hour that gives your heart 3 to 4 hours to complete the digestive demand before sleep begins. At 7, water and medications. A full glass of water with whatever evening medications your doctor has prescribed. And if your blood pressure medication has not been specifically discussed in terms of timing, this is your reminder to have that conversation at your next appointment. Ask directly, would evening dosing provide me with better nighttime protection given my profile? Between 8 and 9, your wind down. A walk if that's part of your routine. Reading. A calm conversation. This is the time to step away from bright screens, particularly phones and tablets, which suppress melatonin and keep the nervous system in a state of low-grade alertness far longer than most people realize. The nervous system needs a genuine transition signal before sleep. Give it 1. By 9, your bedroom. Adjust the thermostat to that 18 to 22 degree range. Put a glass of water on the nightstand. These take 90 seconds. They protect your heart through the night. By 10, you're in bed. On your side, if possible. Back sleeping significantly worsens airway obstruction for anyone with any tendency towards sleep apnea. And sleeping on your side is one of the simplest and most effective positional changes available while you pursue a formal evaluation. Dinner by 7, water and medication timing discussed. Screens off by 9, room temperature set, glass of water on the nightstand. In bed by 10, on your side. That is the complete evening. 5 habits addressed. No dramatic life overhaul, no expensive interventions. Just the evening, done thoughtfully. Now, I want to be honest with you about something. Not as a content creator. As a doctor who has stood in operating rooms at 3 in the morning, I have held hearts that stopped because of clots that formed overnight in narrowed arteries. I have spoken to families in waiting areas at dawn. Families who had said goodnight a few hours earlier to someone who seemed completely fine. I have reviewed cases where the contributing factors, laid out clearly in retrospect, were not mysterious at all. A dinner eaten at 9 at night, a blood pressure medication taken only in the morning whose protection had long since worn off. A bedroom kept at 25 degrees because that was the preference. A body that went to bed mildly dehydrated every night for years. An airway that had been collapsing silently dozens of times per hour while the family assumed the snoring was just snoring. None of these look dangerous in isolation. None of them feel like emergencies in the moment they happen. But stacked together, repeated night after night, month after month, they are a quiet and entirely preventable kind of cardiac damage. The kind that doesn't announce itself until the announcement is far too late for a conversation like this one. This is why I'm standing here outside, away from any hospital, talking directly to you. Because the information I just shared with you in the last 20-some minutes, that information should be part of every conversation between a doctor and a patient over 60. It should be in the brochure, in the follow-up appointment, in the discharge notes after every cardiac evaluation. It usually isn't. Not because doctors don't care, but because the system we work inside is structured around responding to events, not preventing the quiet accumulation that leads to them. You now have what that system doesn't always make time to provide. The question is what you do with it. Not next week. Not after you mention it to your doctor at an appointment you haven't scheduled yet. Tonight. Before I close, I want to ask you something directly. And I genuinely want your answer in the comments. Which of these 5 habits did you recognize in yourself? Not because I want to alarm you, because I know from experience that when someone sees their own pattern named clearly, something shifts. Something that has been operating in the background without scrutiny suddenly becomes visible. And visible habits can be changed. Invisible ones cannot. Leave your answer below. You might recognize something someone else hasn't noticed in themselves yet. That comment could matter more than you know. Now, if this is the kind of conversation you want to keep having, subscribe to this channel right now. I mean that seriously. This channel exists for one reason: to give you the direct, unfiltered medical information that the system doesn't always make time to explain. Every week. No agenda other than your health. If you are not yet subscribed, this is the moment, before you close this video and this information fades into the background of your day. Hit that button. Turn on notifications. Because the next conversation is just as important as this one. And share this with one person. One person in your life who is over 60, who has never once connected their evening habits to their heart health, who has a warm bedroom and a late dinner and a blood pressure pill they take every morning without knowing whether it's actually working when they need it most. That share takes 15 seconds. It could genuinely change something for them. I want to close with the same thought I started with. That patient, the retired engineer, 67 years old. Careful man. When I reviewed his case after everything had already happened, the pattern was clear. Not dramatic, not mysterious, ordinary. And that is the thing that has stayed with me longest, across 2 decades and more cases than I can count. Not the dramatic emergencies, the ordinary evenings, the ones that didn't seem to need any attention, the ones where nothing felt wrong until something was. Your heart has been working for you every single minute of every night of your entire life. Through sleep, through illness, through grief, through ordinary Tuesdays it had no idea were remarkable. Give it the evening it needs to keep going. The doctor may give you the recommendation. The system may give you the prescription. But the evening is yours. What you do with it tonight, that's the most important cardiac decision you'll make this week. Take care of yourselves. Stay curious. And keep asking the hard questions. Every single one of them.